I'm back with Drew, and there's nothing worse when you have to send a medical student in with the chief complaint of abnormal labs. So today, he went in to see a patient with abnormal labs, and the abnormal lab was elevated hemoglobin. The opposite of anemia is called
polycythemia. So polycythemia, things we'll see with that is an increase in hematocrit, increase in hemoglobin, as well as an increase in red blood cell mass.
Yeah, too many red blood cells. What causes this?
So a common primary cause of this is polycythemia vera.
Vera.
And some secondary causes that can also contribute to these types of findings are smoking, sleep apnea, chronic heart and lung diseases, living at high altitudes, and even things like renal cell carcinoma.
Yeah, those are the most common reasons, including polycythemia vera, which we're trying to evaluate here. What symptoms would somebody have if they have elevated hemoglobin?
Yeah, so often these patients could be asymptomatic, but sometimes we'll see some non-specific symptoms, things like fatigue. But some characteristic ones to look out for include itchiness, especially in warm showers, and then also things like gout.
Yeah, the high hemoglobin causes increased viscosity, can increase the chances of clots. But the question is, once we see this high hemoglobin, is there a test we can order to evaluate for polycythemia vera?
There is. There's a peripheral blood test that we can do that looks for a mutation in the JAK2. It's a gain-of-function mutation, and what this does, like he was saying, with increasing the viscosity, it increases the red blood cell mass.
Yeah, so when you have a high hemoglobin, even if you're in primary care, you want to check that JAK2 to further evaluate to make sure we can get this diagnosis. And I want you to remember JAK2 like I remember Jackie Robinson.
Jack Black.
Ooh, I love Jack Nicklaus.
Jack Nicholson.
And when you need it at the right time, some Jack Daniels. And Drew, right here, he's a jack of all trades.